5 medical tests seniors over 70 should think twice about, and the surprising truth behind them. Did you know that in the United States, more than 2.3 million adults over the age of 70 undergo health screenings every year that could actually do more harm than good? These are not experimental treatments or high-risk surgeries. They are routine checkups. The ones you've probably been told are just precautionary. But here's what most doctors don't explain. After age 70, your body changes. And that means certain tests that were once useful may now lead to dangerous overdiagnosis, unnecessary treatments, and even long-term complications like stroke, cancer, or surgery. In fact, a study published by the Journal of the American Medical Association, JAMA, found that over 37% of medical tests performed on seniors result in no benefit. Only stress, side effects, or aggressive interventions that may not extend life or improve well-being. Even more concerning, 99% of older adults have no idea these tests may not be necessary for them anymore. One of the most common tests on this list, one that millions take without question, is responsible for 5% of all cancer cases in the U.S. That's the same cancer risk caused by daily alcohol consumption. You won't hear this on mainstream health shows. You won't see it on your clinic's notice board. But today, we're diving deep into the 5 health checkups that you should reconsider after 70, and explaining why skipping them could actually improve your quality of life. This video is fully backed by science, and we promise you won't believe what made it to number 2. But before we begin, leave us a comment below. Where are you watching from? What's your age? Have you ever had a test or procedure you later regretted? We're reading every comment and replying with personalized advice to help you make informed decisions about your health. Also, don't forget to like this video and subscribe to our channel for more content that empowers seniors to take control of their health through science, not fear. Mistake number 5, brain MRI for mild memory loss. Why this common test can cause more harm than good. When seniors begin to experience forgetfulness, maybe misplacing keys, repeating stories, or struggling to recall names, the immediate fear is often dementia or Alzheimer's. In response, many doctors reflexively order a brain MRI, thinking it will provide clarity. But in reality, this scan may do the opposite. A brain MRI offers highly detailed images of the brain's structure, but not its function. And for adults over 70, the results almost always show abnormalities that are simply signs of normal aging. This includes mild brain shrinkage and white matter changes, which are incredibly common and typically harmless. Yet once something shows up on a scan, even if it's not dangerous, it can lead to a cascade of fear, overtesting, and in some cases, completely unnecessary brain procedures. According to a 2021 review published in Neurology Today, researchers evaluated over 3,000 MRI scans from adults aged 70 to 85 who reported only mild memory issues. 86% showed some form of brain abnormality, but only 3% were linked to an actual treatable condition. That means 97% of these seniors were told something looked off, even though it had no impact on their health or memory. Worse, nearly 12% of these patients were referred for invasive follow-up procedures like lumbar punctures, spinal taps, or exploratory biopsies, based solely on vague MRI findings. These follow-ups can carry real physical and emotional risks, especially for older adults. Unless you're experiencing serious neurological symptoms, such as seizures, sudden personality changes, or rapid cognitive decline, a brain MRI is rarely useful for mild memory issues. Instead, experts recommend starting with a paper-based cognitive test, which evaluates memory, attention, and problem-solving in 10 to 15 minutes. No machines, no stress, no unnecessary diagnoses. Number 4. Cardiac stress test. The overused heart exam that can backfire after 70. Let's move on to the next major test seniors are often given, especially if they mention feeling a little tired or short of breath. The cardiac stress test. This test involves walking on a treadmill or receiving medication to simulate exercise, while your heart's response is closely monitored. Its goal is to detect blockages in the coronary arteries, which could cause a heart attack. Sounds important, right? But for adults over 70, especially those without clear signs of heart disease, this test often produces false positives and leads to unnecessary and risky procedures. In fact, recent studies have shown that up to 40% of seniors have a false positive stress test, meaning the test wrongly suggests a heart problem where none exists. These results often trigger follow-up procedures like angiograms, invasive imaging of arteries, stent placement, or even open-heart bypass surgery. According to a large 2017 study published in JAMA Cardiology, more than half of stents placed after a stress test provided no improvement in symptoms or survival, especially in seniors with only mild or nonspecific symptoms. What did increase, however, were the rates of bleeding, kidney injury from contrast dyes, longer hospital stays, and new health complications. If you're over 70 and don't experience classic cardiac symptoms like chest pain during activity, shortness of breath on exertion, or sudden drops in stamina during light exercise, then a stress test might not help and might actually put you at risk. A resting EKG, electrocardiogram, or a coronary calcium scan may be safer, more accurate options. They are non-invasive, low risk, and provide insight into whether true plaque buildup is occurring, without pushing you toward invasive treatments you don't need. Number 3. The bone density scan. Why this harmless test could trigger harmful treatment. On the surface, a bone density scan sounds completely safe. No pain, no needles, just a quick scan. And then you know if your bones are weak, right? Not quite. This test, called a DEXA scan, measures your bone density and is often used to screen for osteoporosis, especially in older women. But here's the problem. After age 70, nearly everyone's bone density will show as low, simply because bone thinning is a natural part of aging, like getting gray hair or needing reading glasses. The scan might label you with osteopenia, mild bone loss, or osteoporosis, even when your actual risk of fractures is low. Unfortunately, many seniors are immediately prescribed medications such as bisphosphonates, drugs designed to slow bone loss. But these medications aren't always the answer. Bisphosphonates come with risks. They've been linked to side effects like esophageal irritation, severe acid reflux, and a rare but serious condition called osteonecrosis of the jaw, where jawbone tissue begins to die. Even worse, studies show that in adults over 70, these medications make only a 0.3% difference in actual fracture prevention over 5 years, according to research in the Journal of the American Geriatric Society. A 2022 study in Osteoporosis International found that simple lifestyle changes like strength training, balance exercises, and vitamin D optimization reduce fracture risk by over 20%, with none of the drug-related side effects. Number 2, full-body CT scans, the most dangerous, misleading test seniors are sold. Let's talk about the most overused and potentially harmful test for people over 70, the full-body CT scan. These scans are often marketed as part of executive health packages or preventive checkups in private clinics. The promise? Catch cancer before it grows. Detect disease early. Get peace of mind. But the truth is far more unsettling. Each full-body CT scan exposes you to 10 to 20 millisieverts of ionizing radiation. That's equivalent to getting 500 chest X-rays at once. While younger bodies may recover from occasional radiation exposure, seniors have reduced DNA repair capacity, which makes the risk of long-term damage much higher. In fact, a 2023 modeling study published in JAMA Internal Medicine warned that the rise of unnecessary CT scans across the U.S. may now be responsible for up to 5% of all cancers, the same as daily alcohol consumption. That means 1 in every 20 cancers could be triggered by a scan meant to prevent it. The second problem? False positives. Full-body scans often find tiny, harmless things like benign cysts, calcium deposits, or microscopic nodules that are simply signs of normal aging. But once spotted, these incidental findings trigger alarm bells. You get referred to specialists. More imaging follows, then biopsies, sometimes even surgery, all for something that never needed attention in the first place. Take Marcus, an 80-year-old retired martial arts teacher in perfect health. As part of a senior wellness package, he underwent a full-body CT scan. It showed a tiny 3 mm lung nodule, common in people his age. But that small finding launched a medical snowball. A PET scan, a needle biopsy, and finally, a partial lung collapse from the procedure. He was hospitalized for 2 weeks and spent another 2 months recovering. The biopsy result? Benign. There was never any real threat to his health until the testing began. The American College of Radiology now firmly advises against full-body CT scans for routine screening in asymptomatic people, especially seniors. There's no proven survival benefit and very real risks of harm. Instead, here's what experts recommend. Pay attention to symptoms like persistent cough, unexplained weight loss, new lumps, or changes in appetite. If you have real symptoms, get targeted scans, not full-body imaging. Prioritize annual physicals with your primary care doctor who knows your medical history and only recommends tests that make sense for you. The best prevention strategy after 70 isn't scanning your body from head to toe, it's listening to it. Number 1. Colonoscopy after 70. Why this routine test could do more harm than good. You might be surprised to see colonoscopy on this list. After all, it's long been considered a gold standard for detecting colon cancer. But once you pass age 70, and especially after 75, this invasive test can quietly shift from life-saving to life-threatening, particularly when done without strong medical reasons. Let's break it down. A colonoscopy involves inserting a flexible tube with a camera into the colon to look for abnormal growths called polyps. Sounds reasonable, right? But the preparation process is intense. You're required to take powerful laxatives that flush your entire digestive system, which in seniors can lead to dangerous dehydration, electrolyte imbalances, dizziness, and even kidney complications. Then comes sedation, which is another concern. Older adults are more vulnerable to the cognitive side effects of sedatives, including delirium, memory lapses, and in some cases, long-term cognitive decline. And the procedure itself isn't risk-free. Colonoscopy can cause tears or perforations in the bowel lining, bleeding, especially if polyps are removed, and even heart rhythm disturbances during sedation, particularly in frail or sensitive patients. A 2019 analysis published in JAMA Internal Medicine reviewed data from over 1.3 million Medicare patients aged 70 and older. The results were eye-opening. For every 1,000 colonoscopies performed after age 75, only 2 lives were saved from colon cancer. But more than 20 patients suffered serious complications from the procedure. That's a 10-to-1 ratio of harm to benefit. Even when polyps are discovered, many are slow-growing or harmless, especially in older adults. And sometimes, removing them causes more trauma than simply monitoring them. According to current guidelines by the U.S. Preventive Services Task Force, routine colon cancer screening should stop at age 75, unless there are specific symptoms like unexplained weight loss, changes in bowel habits, or bleeding. So what's a better option? For seniors in good health who still want screening, stool-based tests like the FIT fecal immunochemical test or Cologuard are safer, non-invasive, and highly effective at spotting early signs of cancer, all without sedation, prep, or risk of complications. Colonoscopy after 70 should not be automatic. If you're healthy, asymptomatic, and have a history of clean results, talk to your doctor about whether this test is really necessary. And always ask, what happens if you find something? Before agreeing. Medicine is powerful, but it's not perfect, and it certainly isn't one-size-fits-all. For adults over 70, less testing often means better outcomes. Here's a simple checklist to follow. Always ask, what will this test change? Insist on alternatives. Is there a safer way to get the same information? Know your risks. Sedation, radiation, and false positives are not minor concerns, especially as we age. And most importantly, remember, prevention starts with lifestyle, not machines. Stay active, eat whole foods, sleep deeply, and stay informed. Have you or someone you love ever experienced complications from a test that turned out to be unnecessary? What happened? Share your story in the comments below. We read every one and reply with thoughtful advice. Don't forget to like, subscribe, and turn on notifications for more health content designed to help you age smarter, safer, and stronger. Thank you for watching, and I'll see you in the next video.